give a couple minutes for some people to come into the room. Thank you for joining us. Let us know where you're coming in from your companies in the chat. Just a few housekeeping rules. Any questions that you may have, please type them in the chat. There will be a Q&A during this webinar. And if you're coming into the room right now, thank you for joining us for this informational webinar with AmeriHealth Caritas to learn about their supplier diversity program and to get the answers to your questions. Please type into the chat any questions that you may have throughout this presentation. I'm going to give one more minute for people to come into the room. See a few people. We have Global Language Solutions in the room, Linda's Care Home Care Agency, Coriac Consulting is in the room as well. Welcome. And I think we're in good shape. It looks like a couple people are in the room, so I'm going to get started and present to you our speaker. Sharon Minker is an award-winning supply chain, supplier diversity, and inclusion strategist, published author, and keynote speaker with 2 decades of experience. She helps diverse companies connect with people and resources, positions for success, and partners with lucrative deals. Ms. Minker is a manager of diverse supplier initiatives for AmeriHealth Caritas Shared Services. Thank you, Sharon, for being on here, and I'm going to give the floor to you.
Thank you. I'm so glad to be here, and I wanted to introduce everyone to my boss, mentor, partner in crime, Ron Baldwin. Ron Baldwin is an award-winning strategist, boss, awesome guy who is making things happen, has been making things happen here at AmeriHealth Caritas for more years than I can count. But he is here also to join with us as we have this brief discussion. Ron, I want you to say some welcoming words to the audience.
Well, welcome everybody. Thank you, Sharon, for that great introduction. Don't know if I deserve it or not, but thank you all the same. This should be very informative. Hopefully you guys will learn a lot and learn how to do business with Caritas. And we're certainly glad and excited to be here and glad to have you and look forward to this great discussion. Thank you.
Thank you. So let me just tell everyone what's our brief runner show. So our runner show, we're just going to tell you a little bit about us. We're going to get into the meat of what our program is, about our leading and lagging measures, our KPIs, our value proposition to organization. Then we're going to go over what we do with sourcing, how we partner with them in other parts of the business. And then we'll go over what we actually spend money on. That's why you're here. What do we do, how we do it, and how to connect with us and partner for future sourcing initiatives. So this slide here just tells you a little bit about AmeriHealth Caritas. AmeriHealth Caritas is a managed care services provider. I'm not going to be reading from the slide, so if that's what you expect, you can also Google it. You can also go to the website. So we are in about 13 states. I think that has now increased to about 14 or 15. We're moving into new markets rapidly. And as we go into those new markets, we make sure that we have behavioral health care services, Medicare services, pharmacy care services, specialty care services, and long-term services and support for our member base in those areas. What Ron and I do is support all of the spend goal targets for diverse spend in those markets. And so we're going to give you an overview of our supplier diversity program. Our supplier diversity program is how we engage in the communities where we live, we work, and we serve. Now, what does that mean to you? That means we want to make sure that our supply chain ecosystem is inclusive of suppliers that are representative of our community, our members, the people who we focus on because we are member focused. We want to make sure that our members see that we are spending money with businesses that are local to them and that have the same demographics as them. And so I put here together just what our key value drivers are for our program. We want to enable innovation. We want to engage with suppliers. We want to have a community impact. And we want to make sure that our organization is addressing the social determinants of life. And we do that through supplier diversity outreach, making sure that we engage with entrepreneurs who are going into what we call our self-employment series. That is another way of overcoming obstacles and inequities in the community and being able to hit higher targets in the social determinants of life to be able to live healthier lives. We also want to make sure that we are meeting with suppliers where they are and in these virtual events, in these virtual arenas, so we can engage with you. We can learn about you, you can learn about us, and more importantly, we start to build bridges so that we can have a more inclusive ecosystem. Our initiatives are all over the place. By that, I mean, we have so much going on at this time. It is ridiculous, but we're getting it done. And we are all over the country trying to make sure that we are being impactful and intentional about the money we spend, the partnerships that we have, the relationships that we build. We do outreach. And by outreach, that means we attend events, we do matchmaking events, we also host events in different states. We also try to bring our primes to events with us so they can meet diverse suppliers to increase their spend in the tier 2 space. We also have a supplier diversity scholarship where we paid for one diverse supplier to go to Tuck School of Business, Dartmouth, to grow their business once a year. We do workshops with our strategic partners, such as EMSDC and other councils and organizations that give opportunities for diverse suppliers to have development and also to build relationships outside of AmeriHealth Caritas. We do training, both internal, which we call inside our walls, and external, beyond our walls. Inside our walls, we actually hired an MBE supplier from EMSDC last year that did training for our C-suite executives and leaders across the business. What they learned was about the differences between unconscious bias and bias, how supplier diversity impacts them and their personal impact to that, what they can do in their space, in their business entity in order to have an impact with supplier diversity and in the community. And they also learn to address and to think differently about supplier diversity, which is the value proposition that we would like to drive every day so that we can introduce minority-owned, women-owned, veteran-owned, LGBTQ-owned, and disabled-owned businesses to our business enterprise. In order for us to do that, we need to have these type of events so that we can engage, connect, and so that you can learn more about us. Ultimately, we're going to do an economic impact study. Our economic impact study is going to show how we actually impacted the communities where we live, work, and serve. How many jobs do the businesses that we employ are going to give way to more jobs and more opportunities for the community? How much money does that say we're putting back into the ecosystem for instance, the city of Philadelphia, the state of Pennsylvania, for all of our member base, and for our community as a whole? And after we get that information, then we use that as a way, as a tool, so that we can do better, right? We need to know where we are so that we can look at those metrics and we can do better to go further. Ron, did you have anything to add?
Well, a couple of things. In addition to what Sharon is saying, one of the things we did with the attorney we hired to train our C-suite folks, we wanted to really convey that supplier diversity is a journey, and it should be an equitable journey towards opportunities. So you wanted those guys to lead with that message and be advocates to advance, to block, promote supplier diversity amongst their staff, which leads me to those guys agreeing to participate as mentors to diverse suppliers. So we started a mentor program last year where our C-suites, including our CEO, are actually mentoring African-American suppliers. We will expand that in the upcoming years to include every line of business, every state, where each C-suite, each line of business will be mentoring diverse suppliers, because they need to understand the journey that you guys face and also the challenges that oftentimes they are not aware of. So we are creating great awareness, which should lead to a much larger impact on those diverse communities. So we want everybody to be engaged, to be a part, to make sure that our program, it does what it seeks to do, which is to provide equity and opportunity for all of our diverse suppliers. So I wanted to add that because I think that's very important, because I don't think people really understand the journey and the courage and the commitment that you guys have to building a sustainable business, as well as some of the roadblocks that should not be, but we want to make sure we tear those roadblocks down, and that Caritas is an advocate and stands out in the front to take the hits that are necessary to advance supplier diversity. Sharon, you take it back.
That's so important, because what we want to make sure is that there is a less of a disconnect between the C-suite, between the leaders that are making decisions and the suppliers who are doing business with us, and that those suppliers are able and positioned to grow. So thank you for that, Ron. So this slide is just going to tell you a little bit about our procurement and sourcing. What we call our strategic integral sourcing project or process is we talk to each other. Just that. We talk to each other about what's going on, what's about to go on, any future opportunities. We work with the sourcing professionals in supply chain to make sure that we are aware of upcoming RFPs and initiatives, any contracts that are about to expire, so that we can then start to position some diverse suppliers to be included in those initiatives. A lot of times we get calls or emails and say, well, I want you to introduce me to XYZ. Well, it's not that time for that yet. So we're going to talk a little further in this presentation about when to follow up and why sometimes people feel as though there's a disconnect, when it really isn't. The problem is time. The problem is resources, and the fact that we have to be very strategic about when we align you with our business stakeholders. We also encourage our supply chain professionals to participate in events like this. I know we have some buyers on the line. We also have some of our internal stakeholders that are on the line, and some members of our Supplier Diversity Council that are on the line, because it helps them to learn more about why supplier diversity is imperative to everything that we do. And it is a part of all of our jobs to make sure that we are inclusive. We want to help them identify tier 1 suppliers for each of our top high spend categories. That's a goal of ours, a part of our approach. And we want to identify tier 2 suppliers for primes who are already on long-standing contracts, but we want them to report tier 2. I'm going to pause there for a minute and just give you some little definitions of tier 1 and tier 2. A tier 1 supplier is a supplier that does business directly with AmeriHealth Caritas. We have a contract directly with AmeriHealth Caritas, and there are diverse, have a third-party certification. We can count that as tier 1 spend. A tier 2 supplier is when a non-diverse company is doing work with a certified diverse supplier, and they submit that spend as tier 2. That's tier 2 spend. So most of our program is built on the dynamic work that Ron has done with the tier 1 level. And at the tier 1 level, that means we have contracted directly with a diverse supplier for a particular product or service, and we are counting that spend at tier 1. From the tier 2 level, mostly comes from a few suppliers that we have at that level that are reporting tier 2 spend. And so part of one of our goal strategy lines is to actually increase that, but also to introduce more tier 1 suppliers. The way we do that is through making sure that we are aware of different sourcing opportunities, reviewing data, and looking at what categories can be impacted. We get monthly data back from our reporting team on where we're at with each of our categories, how we are actually engaging, what we could do better, and we look at that. But we're also looking at that data to see if there are suppliers that we are currently doing business with that aren't certified. And so a part of our strategy as well is to make sure that we connect those suppliers with resources and opportunities to get certified. Now I know what you're saying, well, what does that mean? Well, I'm gonna tell you what it means. So through our advocacy work that we do outside of the organization, beyond our walls, Ron sits on the board for EMSDC. I sit on the ISM Philadelphia board. I also chair the Women of Color Committee for WeBec East. And we learn of different opportunities that are out there. For example, a month ago, Lowe's had given money to different organizations to certify suppliers. And so I just started reaching out to suppliers and was like, hey, you need to get certified. I saw this out there and it's only out there for a week or something, but here, let me send this information over to you. Or I just send an email blast to suppliers like, hey, get this out to whoever could benefit from it. Because when we learn about those opportunities for diverse suppliers, we share that information out. So if you haven't saved our emails, or if you haven't seen an email from me, or if I'm going into your black hole list, your block list, take me off of it, because I do send out some pertinent things. I try not to spam you, but I do that. We also share information out on our social media platforms so that we can make sure that you have that information and that you are well aware of any opportunities. But what we're most proud of is what we did in 2021. It is a remarkable, awesome thing that we exceeded our diversity spend goal by 146%. I know y'all should be out there cheering. You probably are cheering, but I can't see you. But I'm cheering. I'm excited because that took a lot of work. It took a lot of work because we took what Ron had already done and created this award-winning, awesome program, and we expanded some new initiatives, but we also did a data dive. What does that mean, Sharon? We looked at all our supplier spend for the year. And like I said, I reached out to suppliers who were either skeptical about getting certified and didn't, or who just didn't know they could get certified or qualified, and had those conversations about getting them certified. And also access to resources that they weren't out there, to grants, to scholarships that they could get if they were certified. We were able to get some suppliers certified and to move into that space and get access to different opportunities. And that allowed us to exceed our goal. So I'm very proud of that and look forward to being able to add new suppliers going forward. So Ron, I didn't know if you wanted to make any comments on that, and then we'll just move to the
one
decision
brief
making.
one. That goal is very significant, and certainly we're very proud of that. But that equates to 30%, a little more than 30% of our sourceable spend, meaning all the spend that we contract, all the categories, is going to diverse suppliers. And I think that is well above industry standard. I don't care what industry you're in. You know, that's something I think that we can certainly brag on, and it means that we are contracting with more suppliers, and seeking to create opportunities for all to participate. The challenge is you can't bring everybody along, but we are certainly trying to. But that's our challenge, that we just don't have a large enough pie for everybody to participate. But we are certainly trying to make sure everybody's engaged and has an opportunity to use Caritas to promote your products and to build sustainable wealth. So that's what we're trying to do, and we will continue to do that.
We're going to keep doing it, and we're going to keep increasing our goal progressively year over year, and we're going to make sure that we are making an impact. So thank you for that, Ron.
Yep.
So also included on this slide is our minority supplier registration form. Now, before you even get in your head that, oh, they want me to fill out a form, it's going into a black hole. We don't have a portal, so it's not going into a black hole. It's going to an email for me. And so let me tell you what I do with that information. That email drops in and it has some high-level information on your company, on what you do. And I go into either the EMSDC portal, which is NMSDC Central, and I make sure I compare, what's on there to your industry codes and everything. I do like some soft vetting. I also use that as a way to do a kind of little development piece for some suppliers. I'm saying it says on your website you have this, but it says in the portal you do this. It says on your capability statement you do this. Here's another way you could probably think about that, because if I send our stakeholders out to that information, I'm dropping your profile from the national database. I'm dropping it from the national database because it's very succinct and it has more information, as well as your work experience, all that stuff I can pull from there and match it up. Just as a side note, if you send me an email with a link to a capability statement, I can't open it. If you send me an email with a link to your website, I can't open it. Our cybersecurity will not allow me to open those external links. So some people get frustrated, like, oh, well, she replied to me and told me to send her a PDF copy. It's because I cannot open the link. And so that takes a little more time for me to go and try to research a person's product or services, because we can't open that information. So just a FYI. Our decision-making criteria. The criteria is quite simple. You're going to find this across most major corporations. We want to make sure that you know that safety is a priority. Safety in our context means we run what's called a watchdog report to make sure that your company's not barred from doing business with any governments or US Medicare fraud. We run all of that on there. We want to know about your business continuity. If you don't have us as a customer, or are we your primary customer, and you falter, how would that ripple through that industry? How are you going to proceed? Your track record, like I said, your work experience, we're going to find that when we pull your profile, your full profile from NMSDC Central. So please make sure your profile is up to date, please. The availability and delivery of services and turnaround time for the product or services. We will ask you questions of that. The sourcing professionals also may ask you questions about that. Your capabilities, do you have all the equipment or services to perform what you say you are going to perform? And if not, who are you relying on? Do you have access to capital? Do you need access to capital? How are you going to sustain? Because remember that any supplier we partner with, you are an extension of us. And we need to make sure that your business is sustainable and that your business can grow. We create opportunities within supply chain to make sure that you have access to capital and know about what resources are out there. We create opportunities in supplier diversity to make sure that you can grow, not only with AmeriHealth Caritas, but with other organizations within our network. And responsive time. If I send you an inquiry on something, know that sometimes you may think it's last minute, but sometimes I'm getting it last minute, and I'm sorry, it just happens. There is a lot going on. We are beholden to stakeholders inside our wall and beyond our walls. And by that, I mean, inside our walls, we have a reporting relationship with sourcing and procurement. We also have reporting relationships with all of our market presidents. We also get inquiries from our C-suite leadership. Then beyond our walls, we get inquiries about supplier diversity resources, what we're doing and how we're doing it from legislators, local governments. All these things come into play. So your patience is greatly needed and appreciated. Your due diligence when we ask you a question as a follow-up is greatly needed. And it's not because we're just trying to be redundant. Oh, I sent that information back to them already. It's because I really don't have the time or energy or resources to go searching back for information that was sent. So if you are asked by one of our associates or by someone in supply chain or one of the supplier diversity professionals within our team for some information that you feel as though you probably previously sent, or we should have that, or we should know that, I think we have a lot going on as well. Please just send it. So, oh, Ron, did you have anything to add on that?
Just one more thing. One of the other things I would suggest as you seek to do business with us, if there is, in addition to what Sharon talked about, if there's an innovation or a solution that you provided to somebody, one of our competitors, or something you've done in the industry, that will help to mitigate risk or save money or do something, list that in your, in your email. I provided this solution, which you may find helpful. I think can do X, Y, Z for you. And, that will help to facilitate a conversation. And also, some references, like we do business with the following companies just like you, and we think this innovation can help you because it's helped many others do and become better, or whatever the case may be. I mean, it helps a lot, when you can speak to what you've done in the industry. We're seeking to mitigate any challenges that we might have, and you help to facilitate that process. So I think those things will be helpful as well. All right,
Thank
Sharon.
you. Thank you, Ron. So we wanted to make sure that we gave you this high-level overview of our products and services, sourcing opportunities that we are currently working on, I'll talk about next, and giving you the opportunity to ask questions. You will receive a copy of this slide deck, so that's why I didn't want to spend too much time on it. We want to make sure that we leave a lot of times for the interactive portion of this. I see there are a lot of questions coming up in the chat, so I'm going to take that off of share mode. And we want to make sure that you know how to contact us. You know that, yes, we really do need, or we really would like if you submitted that minority supplier registration form. It is not going into a black hole. It does come into a mailbox for me and Ron to look at. We do gather information from there to get leads on opportunities and also to connect with suppliers around the country. We are currently in the process of working on getting into some new markets, such as Texas. If you followed us on social media, we did an event in Texas the other day, and we have some more coming up there. We are looking for non-emergent transportation suppliers, behavioral health in that state. There are things that are going on around a lot of states. I'm going to pull up the chat here. And so here in this area in Pennsylvania, we kind of don't have anything open thus far, but we are going to be looking at what contracts are going to be expiring soon. And that's going to help us create a new sourcing list. Most of the contracts here within our service company area are multi-year contracts, and they have been on file for a while. Like I said, we have a lot of diverse suppliers in our tier one program right now, and some of those are on multi-year contracts, but we're looking intently at our data for all of our spend categories to make sure that we have an inclusive ecosystem of diverse suppliers, and that there is diversity in each of those. So with that, Ron and I have a lot of work to do. And we have a lot of things that are going to be coming up. So I'm going to pause there for a second to see if we have any questions I can address before I go over some other comments.
And let me just add one thing about Texas. One of the things about the Texas supplier, the Texas RFP, at least doing business with us in Texas, is that you have to have a business that is established in Texas. You have to have had a presence in Texas. I think it's like a year or 6 months. So if you have a business, it has to be headquartered in Texas in order to be part of what we're seeking to do with those MBEs in Texas. That's one of the state requirements. As many of our requirements for other states, some of them are seeking that we do business with suppliers in that particular state, and they have to be in that state for a period of time. So just want to throw that out there because it's an opportunity, but it's only an opportunity if you are headquartered and based in Texas over a period of time. And I'm thinking that period is 1 year to 6 months. I can't confirm, Sharon, but maybe you know. But anyhow, you have to be based in Texas.
Yeah. Now we do have, and I did meet when I was in Texas the other day at the event, I did meet some suppliers who were not MBEs who wanted to partner with MBEs. And so that there's opportunities there as well, right? Because they were Texas Hub certified, and then they would help and partner with you for those engagements so they can submit spend. So there's always a way to think outside the box, right? How can we create avenues so that we can support one another and advocate for one another? So let's see if we have any questions over here. Meg, do you find any questions in the chat?
Yes, we have one question in the chat. It's how can a home care agency located in Pennsylvania become a provider and service your participants?
I guess I can answer that. First, the provider network management team in terms of accepting new suppliers is not always open. That's the challenge. You know, there's quite a few of those home care providers in there. And I think the state is going through a reassessment along with Caritas on the effectiveness of those suppliers delivering care to our members. So I don't think that it's currently open. It opens and closes, and I can't take the time frame because I don't even know, because I'm always calling, asking questions, trying to get questions answered for diverse suppliers. But if you are, looks like I'm reading it, if you are registered, then you qualify to do business with Caritas. But that is at the discretion of provider management, and Sharon and I are on the supplier side. So we may not have all the information, but if you send me an email, then I will seek to find out what's going on to answer your question more directly.
And so I just put in the chat the link so that if you fill out the minority supplier registration request form, that actually goes into our shared email so that either one of us will be able to follow up.
Another question we have is, who is the tier 1 vendor MSP for staffing?
Right Sourcing is the tier 1 MSP vendor for staffing. So everything goes through Right Sourcing. Currently, I don't know if we are planning or seeking to do an RFP to try and create some more competition, reduce our costs. Not quite sure about that, but I know that the MSP is not accepting any new staffing suppliers because they're kind of overwhelmed. And I have been seeking to get an answer, Sharon and I, to get an answer to make sure, to see if we have opportunity for new suppliers. But right now we don't in terms of staffing. Hopefully that will change very soon. I've been out of the office for about a few months, so I will re-engage with Sharon to have that conversation to see if anything has changed.
Yeah, because Right Sourcing did come to our last event. They were a part of our last webinar, and I know that they are actively looking at what they have, but we do not have any direction now. We're going to wait to the next quarterly meeting. So we'll get more information on that and make sure that the attendees are aware.
All right. Our next question is AmeriHealth, does AmeriHealth accept other states, cities, and MBE certifications such as New York City, State of Delaware, Port Authority of NY, and NJ?
Yes, we do. We accept all those certifications from all of the state, federal, and local certifying bodies, as well as NMSDC, and we bank and Veterans NAVOBO, the Veterans Business Certification and Disability in.
Thank you. Our next question is, what specifically are you looking for when you talk about health and wellness, when you're looking for suppliers?
Well, health and wellness, we have like behavioral health. Sometimes they're looking for, how do I put it? So it's psychiatrists, psychology. Sometimes I have seen some spend with professional services for health and wellness providers, but it's niche work. So it depends on what's going on with that business market and that business unit. So I would suggest they put in their form and we could try to do more research.
And also, if you are a provider that is delivering innovative care to the community to help solve some of the problems, meaning that your care is specific to some health issues that are, you know, that equally the Black community, so to speak, or any community. But if you have the ability to deliver care, it's an innovative delivery system, then we're looking to talk to you, you know, because that kind of care, we believe, you know, we can take and help you to take that and turn it into a national business to deliver better care across all of our LOBs, you know. And so if you have something that's innovative, that works, then we certainly want to talk to you, because we have an innovative lab now that was established last year. And we're looking to contract with suppliers that are doing things outside the box, but are very effective on how to deliver care and build up the communities that we serve.
Awesome. Thank you so much for that answer. Our next question is, what are you looking for in consulting when you're looking for consulting suppliers?
Consulting can be a whole host of things. There have been, these are the high level categories. Under those categories are literally about 50 to 100 subcategories. So it could be IT consulting, it could be professional consulting, it could be consulting on breast feeding, it could be it literally is a full gamut. So it can be interesting. So I would suggest if you would fill out the form so I can see what type of consultant you are and see if I can match it to something in our space, then we could do that.
Awesome, thank you. Our next question is there a need to work with medical uniforms or work apparel, including supplies and accessories? So scrubs, I'm sure other things of the such.
Not really, because we are a payer and we're not like a hospital or an organization that seeks to deliver care on site to members. We actually pay folks, you know, the hospitals and providers, we reimburse and pay. So that's not our forte, so to speak, but to answer your question, no, because that's not in our sweet spot.
We have one person, Tal Roth. I don't know what company you're from, but he said that he submitted his registration form back in February and didn't receive any confirmation. And he just wants to know if he's been approved or not.
There is no approved or not. I received it. So I have them. I have right now 586 more to go through. And that is just, I'm an army of one. But tell him I'll put my email in the chat and he can send me an email and I can follow up.
Okay, awesome. Thank you. And I think right now we don't have any more questions. I think you guys have done a great job answering everyone's questions.
I hope so. I want to make sure that everyone is aware of our challenges that we have to go through, but what it takes for us to position you to be able to meet with our stakeholders, and what it requires is a lot of patience. I know that it's frustrating and that you want to get to this next step, but oftentimes than not, you're going to have to be patient till we learn of what sourcing opportunities are out there. Right now, we're actively doing things in multiple states. We have a focus right now on Texas, Ohio, Louisiana, and literally every month it could change the focus depending on what's going on with our business. Our core mission is about our members. And so as we move with different legislations and different rules to support our member base, we have to prioritize things as such. So just want to make sure that everybody knows that.
Awesome. We have another question actually. We have somebody who is a energy supplier. They help institutions and businesses reduce their energy costs. They were wondering how would they be able to fit into your supplier diversity program?
I think we could maybe introduce them to other suppliers. We are currently still working remotely, so I don't know where we would go as far as the energy costs. So this is something that we would have to strategize to connect with. Now, with that said, that keeps me aligned with one of our other suppliers that are on the council in the utility space. I know that they would be poised to jump on connecting with that supplier. So keep in mind that sometimes you're trying to connect to do business with us, but we have people within our network that we know are doing things or have something that you could benefit one of their spend categories. And we do share that information on. We take that form that you sent, attach your profile from whatever, whether it's NMSDC link or whatever state profile we find on you, and we share that information with them. Also, when we meet you at events and we take notes, okay, well, I met this supplier, like I met this supplier in Texas that I know we couldn't use, but I know someone in the utility space that could use them. And so I forwarded that over to them. Likewise, there's a supplier that had some type of medical supply. We don't buy those type of supplies. However, I know that maybe CHOP may have some use for that. So we share that information amongst our network. So don't let that deter you from staying on our radar. Okay, any more questions? I see something else that came up. Meg, was there any more?
I'm sorry, I was on mute. I was just saying there's a couple more questions that popped up. What are you looking, so the next question is, what are you guys looking for in IT staffing? Is there a need for IT staffing?
Unfortunately, right now, there is not. That is a space where we are working closely with IT, even up to our chief information officer, who is very well aware and well versed in what we're doing as our mission for supplier diversity. In IT staffing, we do not have any current opportunities there.
Yeah, I think the biggest thing right now in regards to IT is probably cybersecurity. That's always hot because people are always trying to protect their network from unwanted intrusion. But I think that probably has the biggest room for growth and opportunity.
And now that you mentioned that, so one of the last things that we're going to close with is our next event that we are going to be hosting with EMSDC. So in partnership, we are having our Supplier Development Institute, and that's going to allow suppliers the opportunity to get training on their pitch, on their strategy, and cybersecurity for small business. What I mentioned earlier is that if you are to become a supplier, and if you are a supplier with AmeriHealth Caritas, you are an extension of us. So we need to make sure that your business is sustainable, your business is aware of all the latest cyber security measures, and that you are trained and able to find them and resolve them, and if need be, notify us if something were to come. So that will be one of the next upcoming events in the next few weeks. I believe April 21st is our launch date, and you will be seeing information on EMSDC's website regarding that.
Thank you.
Thank you, Sharon, for sharing that information. And you are correct on the date. It will be the 21st that it initially launches. I think there may have been a few questions that came in last minute. If you don't mind, I'll read them really quickly. What are you looking for in employee benefit space? And that's from Caesar Williams.
That's something that we would have to defer to our HR department on. We don't have them as the current list of opportunities, but we would defer that over to our HR department because they are, they have a lot of initiatives going on right now, but we would defer to see what opportunities in that space.
Okay. We also have another question. This is from Anthony. What is your current furniture standard? Do you have national standard for with your facilities? Excuse me.
We do. We actually have an MBE that is our national supplier.
Right.
For
And
that
we're
space.
currently standardized on Hayworth furniture, which is of lately has started to change. So it looks like we've had quite a few different suppliers depending on the state. And if we acquire a building or actually just rent and move and they have some existing furniture, we try to match it up and stick with the same. But we are standardized on Hayworth, and we are under contract right now with a diverse supplier. That may change. Maybe, I don't know, I think our contract's gonna last like 3 years. So that contract may change within the next 2 years, but that supplier is also part of our response to the Pennsylvania Health Choices RFP, which we recently won. So that means as long as that contract is in place with the state, those suppliers are in contract with us, unless they do something
Egregious.
really crazy. You know, they will have no reason to get rid of them.
All right. Thank you for answering that. And there's one more question in the chat. Do you have any opportunities for an agency to execute a marketing communications plan or strategy, including media buying, advertising, social media management, graphic design?
That's a good question, because I haven't had to tackle that question here, because I actually did some media buying contracts with my previous company. Well, that's a good question. So we're going to ask. And this is why we have these discussions. We haven't had any requests for that. There's a whole team in, all right, so there's a whole team in corporate communications, media relations, and government affairs. 1, 2, there are 3 teams that handle that because we are a national organization. So we would have to do some work on that. So I would like you to email me that question because I want to find out the answer.
Right. I think, and also including your email, your capability statement, you know, and your certification, because you may have a unique opportunity to contract if you understand how to communicate with a certain group or ethnic group of people, which everybody doesn't, you know. So those things are very important because maybe you have experience dealing with people in rural areas. I don't know. But, you know, you may have some innovative things that we might want to look at and take a deep dive in to see. So send Sharon the email along with your certification and capability statement.
Thank you guys so much. This has been very insightful, even just on EMSDC's side. As mentioned, this is being recorded and the slides will be shared. So I want to thank Sharon and Ron for joining this UpNext series and being a part of this. I think people are going to walk away with their questions answered even after this. So we are, you know, so honored to have you on this series. And thank you for everyone who joined in attendance and participation. Thank you so much.
Well, we really appreciate it. Thank you so much. And I hope that you guys saw the links that we put into the chat. Do connect with us on LinkedIn to look for other opportunities to connect with us and our sourcing teams who will be joining us later on in the year for several other events. We look forward to seeing you in person one day. And I hope that everyone stays safe and be well.
Yeah, thank you, MSCC. Thanks, Brittany. Thank you, Sharon, and everyone for attending. And as Sharon said, be well, stay blessed.
Yes. All right. Thank you, everyone.
All right.
All right.